Um, some of you know me maybe only from the Facebook group, but my name is Aisling Caffrey, and I really should put the pronunciation of my name on my Facebook page. And many of you met my father yesterday. He's very friendly. He's Irish. And so my name is an Irish name, which is pronounced Aisling. Anyway, so I'm at the University of Rhode Island and the Providence Veterans Affairs Medical Center. And so we received our diagnosis for my son Javi. So a lot of you guys have seen his picture or videos on Facebook. He's 5.5. We received our diagnosis 2 years ago. And when we received our diagnosis, like so many of you, we were given our neurogeneticist gave us the paper by Dr. Z. And so the first thing I immediately did was email Dr. Z. And so my background is I'm an epidemiologist. I actually specialize in an area called pharmacoepidemiology. So essentially I study how drugs are used in populations and how well those medications work or how they're being used in populations. And so I come from a scientific research background. So of course, once I emailed Dr. Z, you all know how receptive he is, and then we started chatting. My whole life is about writing grants, getting funding. And so very early on, Dr. Z and I realized there were some really great funding opportunities. And so this conference, the conference last year and this conference are actually funded through a grant from an organization called PCORI. So I'm gonna give you a little bit of information about what PCORI is and what we're really trying to achieve with these conferences and these other activities that we've been working on. Because really it's about an idea, the idea behind it is that we all have an active voice in where we go with research and clinical care, so that the patients and their families and all sorts of different type of clinicians that you work with, which we will refer to as stakeholders, have a seat at the table and are contributing to that conversation about where we should go in terms of research and information that we need. So I just had some objectives. Some of this stuff, again, this is probably repeated for some of the families, but this is brand new from some of the others. And in the interest of time, I'm gonna go through some of these things kind of quickly. Feel free to stop me if you have any questions. I do not like lecturing in this sort of format. I like to be sort of sitting down with everybody talking together. Feel free to come up in the middle and ask a question. I want it to be a little bit more conversation-based. I'm just going to tell you a little bit about the Patient-Centered Outcomes Research Institute and what patient-centered outcomes research is. Also, comparative effectiveness research, which really goes hand in hand with PCOR, Patient-Centered Outcomes Research. I'm going to talk about this engagement award that we have, the grant that we have, and the activities that we've been working on. And then we probably won't have too much time today to go through the discussion about research priorities, but the goal of this, and we'll have time tomorrow afternoon, is what are the questions that are most important to you? What are the research questions that are going to impact the lives of your children and adults with SAPI2-associated syndrome? And so we need to start making the list of those research questions and prioritizing them so that we can direct our next efforts. So this grant gave us the opportunity to just come together and build a community. And now the next steps are, what do we decide to do as a community to move forward in terms of research and grant funding and things like that, different activities? So the Patient-Centered Outcomes Research Institute is an independent nonprofit organization that was authorized by Congress in 2010. It was actually established and funded through the Affordable Care Act, so Obamacare. But it established this organization whose mission is to provide patients and stakeholders and their caregivers and clinicians with evidence-based information. So as a healthcare researcher, there's been a huge movement in the past 20 years for evidence-based medicine, except the problem has been a lot of medicine there's no evidence for. There's a lot of decisions that you make in healthcare that there really isn't evidence for. And that's even more true for a rare disease. We have no evidence for what type of speech therapy is best in our children, right? Because there's only about 200 children we know about. So it's really hard to get this evidence in healthcare in general, but then even harder for a rare disease group. And so PCORI was established to help us make better healthcare decisions. So again, so what I just said, so lack of evidence in much of healthcare, and so they're trying to address the challenges that clinicians and patients face in the real world. It's supposed to be very real world to see what's going on and answer the questions that matter most. Because if we're all not talking to each other, if clinicians aren't talking to patients and listening to them, and patients aren't talking to clinicians, we have different objectives and priorities with where we go. And so by coming together, we'll answer questions that are most meaningful for patients and their families. So a little bit of background. So I was trained as a traditional sort of typical public health epidemiologist. And in epidemiology, you study how much disease there is. And so really it's considered the science of public health. Patient-centered outcomes research is just looking at how the healthcare system treats patients and how well that works. And when the patient-centered aspect is getting the opinions of patients in terms of outcomes that are important to them. So if we talk about, so disclaimer, a lot of my examples relate to older men because my research is based in the Veterans Affairs population, which is mostly older men. I actually study drug-resistant infections. I know nothing about kids, and you'll, as evidenced by when you see me running around after my kids. So this is very new to me, based on the difference of my expertise. But so if we think about outcomes, we think about, okay, you take a statin to lower your, statin medication, that's a pretty familiar medication. A lot of us may have family members who take a statin or ourselves take a statin. You take it to lower your low density lipoprotein. Well, as the patient, what does that mean to you? Not a whole lot actually, because if you don't take your medication, you don't have any symptoms. Right? You don't feel when your low density lipoprotein is high or low, but you may have side effects. So we need to see what is important to patients and how do we convey this sort of information? Well, it's actually important that you take it because you reduce your risk of cardiovascular diseases and it should outweigh the risk of some of the adverse events. And so this is the conversation that we have. Some of these outcomes we study are not very important to patients. And so we need to also be studying the outcomes that are important to patients in terms of quality of life. Okay, so there's a few different stakeholders when we talk about patient-centered research. We have, of course, the patients and the preferences of their families related to needs, autonomy, and quality of life. And again, this is something that has not been existent in much of healthcare research. So now there's a huge movement to including the patient voice in research and clinical care. Other stakeholders, of course, are clinicians, and as we all know, we see a whole slew of clinicians for children with SAPI2 associated syndrome. So right, we may be seeing genetics, and even as evidence in the clinic today, genetics, neurology, developmental pediatrics, ENT, craniofacial, dental, orthodontics, etc. And so we want all of these people to be engaged because right now, you all are the expert, most likely, except outside of this clinic, in most of the specialties that you see. So how do we bring them in and have them engaged and wanting to be part of sort of the care team for children with rare disorders, particularly SAS? And then there's also all the therapists, right? So speech, occupational therapy, physical therapy, behavior analysts, speeding. And so these would be all important stakeholders in terms of the community we want to build. All of these clinicians play a role in the quality of life of our children. Other important stakeholders are researchers like Dr. Fish, right? So she's doing all that incredible research, and like I said, she was researching the SAPI2 gene long before many of us had a diagnosis. So engaging with them and seeing, again, last year she said, as some of the questions came up from families, how important that was to really inform the directions for her basic science research to take. We also have purchasers, so employers purchasing health plans, payers, public and private insurers, like these questions came up a lot in the AAC talk. Who's gonna cover what? How is it gonna get covered? And so they are part of this community who need to understand the disorder and the needs of the children. And then also industry, so producers of products used in healthcare. And once we start to have more information, like Dr. Fish was saying, about the processes and are there therapeutic agents or medicines that can be used, this is where we could really engage those other stakeholders to see how they can help and contribute. Also, we have our whole health system partners, stakeholders and partners, and training institutions. So again, the idea, as we get the word out in genetic groups, pediatric neurologists, they need to be aware of this syndrome also when their patients present, right? So we're trying to engage as many of these stakeholders as possible to, number one, raise awareness about the condition, and then figure out next steps for research and future going forward clinical care. So comparative effectiveness research, the idea with this and how it's tied into PCOR is when I was saying there's not a whole lot of evidence for medicine for a lot of our healthcare decisions. So we run clinical trials, and in a clinical trial, you're essentially testing if a drug works better than nothing, right? A placebo. So that's great that a drug works better than nothing, and it's somewhat safe. But what happens now when you have a few different choices? And the way we can think about this is more easily is, especially in speech therapy, which speech therapy is best? We have no idea, right? And this reigns true in a lot of healthcare. Again, I'll go back to my statin examples. Which statin is better than the other? Or which type of dosing regimen? We don't know because those types of studies aren't being done. So comparative effectiveness research is where we're directly comparing two interventions. It could be medication treatments, it could be things like speech therapy, it could be occupational therapy approaches, but we're comparing two things. And these are generally things that would be used usually in practice, and we're trying to figure out which ones work the best so that we have more evidence for making healthcare decisions. As applied to SEPI2, we think about diagnosis and treatment and then speech therapy. Again, the vitamins, the fish oils, these are all the questions that we're gonna have are, do they work or not? And then also which work better? So these are just, again, examples of real world interventions. So if we think about, again, statins, if I take my statin as prescribed, does it lower my cholesterol? And then how much does it lower my cholesterol? What if I take my statin usually as prescribed, but not always? Does it work the same way? And what about if I rarely take it as prescribed? How does it work also? That's the same idea as we could apply to speech therapy. What if we're doing 4 hours of speech therapy a week? What if we do 2 hours? What if we do 1 hour? How about the structure? If speech therapy is structured as 2 1-hour blocks a week rather than 20 minutes every single day, which one is better and how is it going to really produce different results? And again, same thing with time working on AAC type of devices. What approach should be used, how much time is important, and how is that structured? Also, safety is an important component that will come into play as new medications or interventions, usually medications are used. But are there differences in safety between these different approaches? And how does that tie into how effective they are? So again, how do we know which treatment intervention is the best for specific patients? Often we don't know. And there's a lot of what is called, it's a big word nowadays, called heterogeneity, which just means, hey, we're very different. And as we see that even among our SEPI2 children, they're very different. There's a lot of differences between people. So even a therapy that works perfectly for one person may not work that well for somebody else. So how do we figure that out and then tailor interventions to people based on their needs? So this is, again, sort of where PCORI comes from. So the goals of PCORI are assist in making informed healthcare decisions and then examine questions that are important to stakeholders and patients and their families. So the PCORI Engagement Award, which is the grant that we have, is the goal of it is to build meaningful partnerships between patients, caregivers, clinicians, and other healthcare stakeholders. This is specifically the Eugene Washington PCORI Engagement Award for research meeting and conference support. So Dr. Z and I submitted this grant and we got it. Hence, all of this has been possible over the past 2 years. Thank you, it's exciting. So I guess it's a really important point to make is that we are about 13 months in. It's a 2-year award. Year 1 is down, and I'm going to share some of the great things we've accomplished, and we have 1 more year. And these are going to be some of the work group activities. But going forward, we are not going to have the support for the conference. And we're not going to be having, even as we can plan now, that will move through the foundation, and Allison is going to be telling you all the great things that she's doing with the foundation. The conference will now be going through the foundation, and hence we're moving to the every other year model. Because again, we're not always going to be able to find the financial support to make this happen. So the important part of me wanting to remind everyone of that is that it's going to come from us. The continued effort and movement to have these conferences and grow the community that we have through the SAPI2 Foundation is going to come from all of us participating. And we also want everyone to have a say. So to become active in the foundation groups, volunteer groups, and through the grant, the volunteer groups, we really want everyone to contribute because we all really want your voices heard. Okay, so a little update about sort of the work group aspects in the conference. So the first conference, so when we wrote the grant, we expected 65 attendees and 22 families for the conference last year. And we had 47 families and 174 attendees last year. So it was a huge success. It was really exciting. It was a learning curve. Because again, I'm a scientist, I have no idea how to organize any of this stuff, and Dr. Z either, and somehow we figured it out. And a lot of lessons learned from last year. And again, now we have the foundation and Allison's support, and so I'm hoping things are going much more smoothly this year for everyone, and we are enjoying it. This year, we had initially anticipated 26 families with 80 attendees. These numbers, you guys probably saw a few last minute cancellations. So I think we were actually finally at 43 families, probably 200 attendees, and 27 are new families. No, sorry, 23 are new families, 23 of the 43. So about half and half from last year and new families, which I think is a really nice mix to have. So the main goals of the conference are really to support open and informal exchanges between clinicians and researchers and the families and the children, right? And then presentations on topics that will assist accomplishing the project objectives, which is really building this community and talking about the questions that are really important to us. So the main goal of the project was to build an alliance of patient and stakeholders for the development of a patient-centered research agenda related to SAPI2 associated syndrome. So that's going to come up again. Again, I want you to start thinking about for tomorrow because it's going to be a little bit more discussion-based, but what are the research priorities that you have? What are the questions that you have that could really impact your child's life? And to just start discussing those together and figuring out where priorities will lie. So the update about the interim, we call them interim engagement activities. It's so fun when you write these grants, you've got to figure out these sort of catchy phrases. But really, this is just some work we've been doing in between to, number one, raise awareness about SAPI2 associated syndrome and provide resources for clinicians and families. So the first engagement activity, so we had 3 engagement activities: development and dissemination of engagement materials. Oh my gosh, these words, right? Essentially, we want to raise awareness. PCOR CER trainings. The idea behind this with PCOR is that they want families and caregivers and patients to be informed about research methods so that you have an active role at the table of any research going forward. So there's not that barrier where you don't understand the research that's going on, that you have training to know how to do this research, and then you have a really active role at the table in terms of research going forward. And then one of the activities was to review PCOR and CER studies on rare genetic disorders. The idea here is that we're not the first new rare disorder. We're not the first new rare genetic disorder. There are groups and disorders that are 5-10 years down the road, and they've already sort of been through these different funding lines and research studies, and what can we learn from them so that we maybe don't run into the same pitfalls or waste our time on something that sort of led to a dead end, to really have a more efficient process going forward, so to learn from those other groups. So these work groups include folks, family members, and healthcare stakeholders. There is some compensation, so I'm going to be asking for volunteers tomorrow. So there is some compensation available for those who want to participate in these activities going forward. And the expected effort will vary within each work group, and I'll chat a little bit more about that tomorrow. So I want to tell you about what we've accomplished so far. So the development and the dissemination of engagement materials, we wanted to create 2 information sheets, one for families and one for clinicians, medical providers, like speech therapists, et cetera. And so we have finished these. And you all have them in your folders. Again, the information is similar between the 2, but we weren't sure that they would always come as a pair. So sometimes a family might get a hold of this, but then they need to convey this information to their medical person. Hence, we have on the I know it's hard to see, but on the medical one or on the family one, we say, hey, give this list of tests and whatnot to your providers. And so some of the information is overlapping. Okay, so you guys have those copies. So we've also, another goal was to translate them. We've actually translated them into 15 other languages. So those are not up. We have a few done. So now they've been translated. They're just getting made to look pretty in this format, which is pretty time consuming, as you can imagine. And so we're in the process of getting everything put into, all the translations put into this format. The next goal is now dissemination of this. So how do we get this out there? So you guys have copies now. It's going to be up on the foundation website. You can download the PDFs. The translations as they're available will also be put on the websites. You'll have the medical professional one and the family one. So the passive dissemination is that they're just available on a website. But we actually want to do some very targeted active dissemination. The idea here is that we would like to send it out to different specialties, clinical groups. So for example, children's medical centers, genetic groups, developmental pediatric groups, neurology groups. Folks who may be seeing these patients, right, and not have thought to test for STEP2 associated syndrome. So to get more awareness in a place where we could increase diagnosis, we could get folks diagnosed if they have this. So that's one part. The other part is making then providers aware of resources to provide families when they are diagnosed. And so rare disease groups, we want to disseminate these to health agencies, local, state, national, and international, and other rare disease groups. And so what I will be asking in the post-conference survey, there's going to be a section that just asks, where do you think we should be sending these to? Who did you get diagnosed through? You don't have to tell me that, but if it was the pediatric neurology group, was it a pediatric genetics group, which medical centers they were, because we're going to also sort of mail these out so that people just have them on hand too. Again, just get the information out there to say, when they see a patient that presents with these same sort of characteristics, think to test for this condition. So we need your help with the dissemination, and again, in the post-conference survey, if you can include the name of the place or the name of the person, an email address or a mailing address, that would be great, very much appreciated. And then we are, wherever you guys send us the list of places to send you, we are going to send it out via email and snail mail. Even again, we can send out via snail mail internationally. So wherever you think that we should be targeting the dissemination of this, we really appreciate your input on that. One other thing is that when you share outside of the recommendations, so if you realize that even in the Facebook groups, hey, maybe the cleft parents group, maybe we should share this information sheet out there if you're in one of those other groups. It would be great if you let us know about that, because it's really nice to be able to go back to the funding agency and say, hey, look at all this great stuff that we did and all this awareness that we raised. And it's going to make us look really great for some other types of funding that they have. So often when you receive funding through a certain agency, there's different types of funding. And so if they funded you once before and you've been really super successful and everyone's super engaged, it increases your likelihood of being funded yet again. So if you are sharing it, please let us know. Anyone that you share it with, even if it's your pediatric group that you shared yourself, please just let us know. The other 2 work groups that we've been working on are the PCOR CER trainings. So the first thing we did was review available PCOR and CER trainings. And now we've finished this and we have this list of trainings available. Next, we're looking for volunteers of folks to complete these trainings and then also provide reviews about them. Was it useful or was it not? Did you get something out of it or not? Do you feel more informed to sit down at the table and help work out some of these research questions or not? And then from everybody's feedback who does the trainings, we're going to go ahead and develop a list of recommended trainings. And we're going to provide that feedback back to PCORI so that they can see that maybe there's certain trainings they would like to direct folks to. This is the list of trainings. One is actually through the Agency for Healthcare Research and Quality. This is a recorded webinar. It's an hour and a half. So again, if you have an hour and a half time that you'd like to sit through this webinar, you can let us know in the post-conference survey if you're willing to do so. And again, it's a short survey that we would ask you to take just to give us a little feedback about it. There's also Research 101, what are PCOR and CER from the Hemophilia Federation of America. I believe they created this from a PCORI grant. Yep, they created this from a PCORI grant. And so this is a video, 30 minutes long. And then we have some that are a little bit more intense. One was from the University of Pittsburgh. It's a stakeholder engagement research guide. And these are not webinars. These are just materials. It would be a self-paced review of these materials, which would take probably about 2 hours. And then we have 3 that are a little bit more intense. And again, it is self-paced review of materials, probably about 5 hours ever. Again, we do have compensation if you're willing to participate. So we're looking for folks, again, to sort of go through these and give us their opinion about them, because I can go through them and have a certain opinion, but it doesn't mean it's going to be the same opinion that somebody else has. And so we want to get a couple different people to go through each of these and give some feedback so we can really see how useful they were. We're also going to be holding a PCORI methodology training for patients and stakeholders, a one-day training. We had thought about doing it in the spring of this year, but then we moved up the conference and anyways, timing. So now we're looking at January 2019, tentatively in Atlanta. Again, there would be funding for you to come out there, and it would just be a one-day long, probably good 6-hour day of training. I would be doing, it's actually a curriculum that was developed by PCORI, and it's actually what I teach. So it's about research methods. And so it'd be that one-day training. So if anyone's interested in coming to Atlanta, we were gonna hold it in Rhode Island in January. And I thought, that's just a terrible idea. It's not very easy to get out there in the first place, and then particularly in January. Hence, we're trying to move it to a place that will be a little bit easier for folks to get to. So if anyone's interested in that, keep that in mind. The last one is the review of the PCOR CER literature on rare genetic disorders. And so we've gotten a start on this. I'm not going to, for time's sake, I'm not going to go through all this, but so we've identified some articles, and what we're looking for now is folks who are just willing to read those articles and take some notes on it and share back, how useful is this? What can you take from that we could potentially apply to SAPI2 associated syndrome? So the effort here is a little bit, it's as much, if you wanted to review 5 articles, that's great. If it's only 1, that's great also. And so we're just looking for folks, again, to look through this and think about how we can apply it back to our group and our community. Okay, so I went really fast. Does anybody have any questions? So, yes.
Where did the original funding come from for the 2 years? You must be fairly significant.
For the 2 years, for the PCORI grant? Yep, so it came directly from PCORI for one of these engagement awards, and they have 2 different kinds. One that's like a 1-year award just for one conference. Well, they have a bunch of different awards, but particularly the Eugene O'Neill Engagement Awards. One of them is the 2-year award, where we were able to fund 2 conferences plus these other trainings, plus these other interim activities. So the goal is that once we sort of accomplish this, to see about next steps, and I'll chat about that a little bit more tomorrow, as we think about research priorities and questions. The different research questions, different funding agencies match up with different research questions. And so based on the priorities of what our next research questions are and next steps for this, that would sort of dictate where we would go to different funding agencies. Any other questions? All right, thank you everyone. I know it's been a long day. So now it's time to have some dinner. We're going to do the group photo.